Welcome back. There is a live look outside from the Oregon coast. Some people kicking off their weekend early there. That's our Inn at Spanish Head Resort Hotel camera in Lincoln City. Thanks for watching Afternoon Live. You may have heard the terms trigger point or muscle knot, but what do those actually mean? Here to explain, we welcome chiropractor Chris Cooper. Great to see you.
Yeah, thanks for having me back.
Okay, myofascial pain.
Wonderful
What are we talking
pronunciation.
about? Thank you so much. I've been working on it. What are we talking about when we say that?
So myo means muscle.
Okay.
Fascial means connective tissue. So it's kind of like muscle connective tissue pain.
Okay.
And it's categorized that way because sometimes it's muscle, sometimes it's connective tissue, sometimes it's both. But they have a typical pain presentation, and so you can categorize it and be able to treat it better if you know what it is.
Okay. That sounds like a lot of aches and pains that a lot of people probably experience all the time.
It is. It's
Okay.
massive, yeah. And that's why like chiropractors see it a lot, because muscles and bones is kind of what we do.
Okay, so a trigger point, what does that actually mean?
So if you've ever heard like a knot or felt a knot
Yeah.
before, it's just a fancy way to say it's a knot.
Okay.
So it's like the muscle balls up,
Yeah.
you know, it gets contracted. You know, if you imagine, you know, you're cooking spaghetti and you have an uncooked spaghetti and it comes in that package and they're all lined up.
Yeah.
That's kind of like the way your muscle fibers are. And if it gets all balled up, you know, within, that creates like a knot, and
Okay.
it feels that way.
And then can that radiate pain to other areas?
Totally.
Okay.
And that's a really big tried and true symptom of a trigger point.
Okay.
When you, like on this diagram, you see where the X's are, that would be where a trigger point is, and the painted red is where the pain would go. And so you see on the left, up in the upper shoulder, you could have a trigger point that will refer pain up the back of your head. Sometimes it will even land behind your eye or your ear or your eyebrow. And that's a common pattern that people have headaches,
Yep.
but the problem is actually in your shoulder or your muscle.
Okay. So you're feeling the pain in one place, but the actual issue is located somewhere else.
Yeah. like
That's a fun mystery.
Yeah, you got a knot here, but you feel that pain kind of radiate
Yeah.
up and over. Like here's another one where in the rotator cuff you have a trigger point, but the pain goes down the arm. Oh. And so sometimes I'll have people come in, they're like, oh, my elbow is killing me, or my thumb is killing me. And I poke on their elbow and their thumb, and then nothing's wrong with it.
Sure.
But you find in their rotator cuff, massive trigger point.
Okay.
You work out the trigger point, magically the thumb and the elbow feel
Okay.
better.
Well, then let's talk about relief. What are some things or tools that you can use?
So there's lots of options.
Okay.
Some are more instrument assisted, where there's like these little metal tools and you scrape along the muscle. Like you see in this picture, that metal
that
tool
sounds
is
painful.
basically digging out a trigger point.
Right.
It's like ironing it smooth.
Oh, no. Okay,
there's
great.
also things like cupping.
Uh-huh.
You see that with acupuncture or massage
Okay.
or chiropractors use, where you have a cup. In this situation, they're actually dragging the tissue, and so
okay.
it's a way to break up the fascia, like pulling it apart a bit.
Okay.
That works really well to get the blood flow in, but also move the tissue.
Sure.
Sometimes when it gets all clumpy, that's a medical term, by the way.
Yeah.
It hurts.
Yeah.
It hurts, and it builds these knots, and it doesn't feel good.
What about something like a massage gun, like those things you can buy to use at home? Are those actually beneficial for something like this?
Yeah, it might not be so great for the knots, but for
Okay.
in general, it gets blood flow come into the area. It loosens things up. Like on this video, you could see the skin kind of vibrating.
Yeah.
That vibration is really good to help break up fascia, get it mobilized, make it move. You're
Okay.
just trying to get it to move nice and let the blood flow normally again.
Okay. I think a lot of us can think of, okay, I've got a knot here. I know I've had one here in the past. When do you feel like is a good time that maybe I should call in some extra backup here?
Usually if you can't get it to release on your own, like you could buy cups to have at home. You know, there's silicone ones, there's plastic ones. You can get the massage gun for home.
Yeah.
You can get your partner to dig on a muscle.
Yeah.
Sometimes it's just not enough.
Sure.
And, I get knots and I try to work on myself, and sometimes I can't get it.
Yeah.
And so, luckily I know a chiropractor.
I was
And
gonna
so
say.
I'll go in and I'll get worked
Yeah.
on too, or a massage therapist, things like that.
Yeah.
And sometimes you just need someone else you can relax, and the provider does the treatment.
Right. you can take your mind off of what needs to be done because somebody else is going to make sure you're taken care of.
Sometimes in the moment it hurts to get worked on. You know, you're getting this knot worked out and you're like,
Yep. Yeah.
and it, you know, like all you got to do is breathe and relax.
Totally.
And then after it's over, you feel like $1 million.
Okay. We can do it. We can power through. All right, good stuff. Thank you so much. Great to see you.
Yeah, it was good to see you.
Okay, for more at-home tips from Dr. Chris, just head to our website at katu.com and we'll link you. We'll be right back with more Afternoon Live right after this.